like to welcome you to School Talks, and it's a great pleasure to have you on board. So I'll just introduce you first to our audience so that they know what a brilliant personality you are, and they'll be as excited as I am. So Dr. Ketaki is a clinical psychologist and a school counselor trained in primary and advanced RECBT. And I'm from New York. Oh my God, that's so more fascinating. And she's a certified psychology coach from inspiring evolution and people throughout her lifetime. And a brilliant personality like her is always a pleasure to be around. So, can you please say a few words about yourself and tell us what you do?
Yeah, sure. So thank you so much, Kavya, for having me on this platform. Mental health is something which is very close to my heart, and it was, and it always will be forever. My aim as a mental health professional, I have been working in this field now for the past 6 years. And throughout this 6 years, I have learned so much from everyone with whom I interact. I have gained so much of knowledge. I've gained so much of experience in this particular field, and every single day I just fall in love with this field because the kind of magic that it has. Whenever I counsel a patient and whenever I see their happiness, that there is some change that is been that they are going through, and they feel so happy. And to be honest, to be very frank, being in the field of psychology since 6 years, it has got a lot of changes in my personality as well, in my overall development as well. I have literally broadened my perspectives, and being more open-minded, being more communicative, and being an active listener, because that is something that a psychologist or a counselor needs to be. It needs to be an active listener to be able to hear out, to be more empathetic, and to see people go through this magical process of change. It's always a pleasure, and it always will. And my aim will always be to create an awareness about mental health. And through this platform that we have today here, I will try my level best to create an awareness about mental health, and suggest people to talk more and more, because it is equally important as your physical health. Because if our physical health and our mental health are on the same page, we may be able to function productively, creatively, and our mind and our body stays fresh.
Exactly. So, as I said, I'm excited about the fact that you studied in New York. So, was there any change of mindset there as compared to India, like related to when it comes to mental health?
So, frankly, I studied from an institute which was in New York. I had attended a course from India. So, we had a professor from UK, Professor Wendy Dryden, who's a pioneer in this field of RECBT. And when I started studying this therapy as a whole, it talks about how your emotions and leads to the particular consequence or particular problem that we are experiencing. Right. And I have seen that amount of, I'll tell you, I owe that credit to RECBT. It's because of RECBT, probably I have broadened my perspectives more. And I did develop a different outlook towards problem, because there are different schools of thought in schools of therapy in psychology. Right. And every therapy has its own rationale, has its own benefits as well. So I would rather, owe that entire credit to psychology and to this therapy that has really gotten some change in my perspectives. And it's really magical.
So let's move forward. So I would introduce our audience to the topic. It's fear of COVID on the minds of the younger generation. And as we know, everybody is suffering from some fear or the other related to COVID. So have you personally experienced any fear that you have related to COVID, Dr. Ketaki?
Fears, yes, because suddenly there was a complete shutdown of schools. And because I used to conduct workshops for school students, for parents, for teachers. So all of a sudden, it all came to a standstill. So that was one of the fear that I had. Another fear being, of course, what if I'm down with COVID? But right. This is something which I think most of us on this platform would have that fear that what if I am down with COVID, what if, because
Then
it takes a lot of time to recover. But I have personally, in this 2 years of the pandemic and 2 years of the lockdown, I have kind of developed a positive approach that things will settle soon, because that is something which is more important, to have a positive approach, because every situation, everything has a flip side to it. What happens is, we as human beings, to an extent, most of the times, we focus on the things that starts with the word no or not, and that makes our life a little difficult. So rather than focusing on the word no, instead of saying no, let's see what can be done to prevent this.
right. So let's move forward to the questionnaire, and I'll be starting it. So my first question to you: what are the biggest fears for the younger generation during the current COVID era? According to you, do you feel there's anything that is mostly affecting our generation when it comes to COVID? Their biggest fears or something?
Of course, yes. Like recently, a couple of days back, I saw this skit. I saw this drama skit on, COVID, which was actually performed by a group of school students, and it was so wonderfully conveyed as to what plight they were going through because of this pandemic. The schools were shut. They had to switch to online school, and their playtime was nowhere. They had no physical play, because what we say is that physical activity of any kind, be it as good as 10 rounds in the house, is also enough to refresh your mind. But that was something which was halted. And those students did convey their plight in a way that, please start the schools, or please allow us to play for some time, because being in house or being stuck in the four walls of the house, it's happened that we have, to an extent, we have glued to this digital world and this virtual world. And kids nowadays, or children nowadays, would want to stay in that world. So rather than that, kids were literally asking, and these are their biggest fears, that what if school doesn't reopen,
They don't get a chance to play,
and don't get a chance to play, we don't get a chance to meet our friends, and that tiffin sharing, that notes sharing, and all those talks as to what happened in my house and what did I do over the weekend, is something that, of course, I feel are the fears that children are facing. Yes.
Right.
Yes.
And I think not just staying at home, the loss of the family one is also something that I think the children are facing a
Yes,
lot.
absolutely.
Because I've seen a lot of parents and are being separated due to the COVID, and
Correct.
they're not
Correct.
there.
Yes, I have experienced throughout this pandemic. I have had a lot of
As you
cases.
said, you're a school counselor as well.
Yeah.
So you must have seen like some children have lost their parents. So what is, you might be having conversations with them? How is their reaction? And they think you cannot say anything to them because somehow their entire world has collapsed to it.
Correct.
So
Correct.
how do you come up with that? How do you normalize that?
So basically, see, of course, as you rightly said, that losing a loved one is just like the world shattering, and
Right.
the child doesn't feel like talking to anyone, or probably is feels isolated, feels a little lost in their own world. They don't know how to react, they don't know how to respond when people ask them certain things. So
Right.
what I believe, or what I would have, what I would have done, is making that child feel comfortable, and not asking them to talk and talk, because the more they talk, the more they feel a little pressurized. They don't know how to say, they don't know how to react certain things. So I let the child be in their own comfort zone, play. It's like, the child is aware of what has happened, but at the same time doesn't want to accept it, that this has happened. The acceptance is something that, it's a struggle. For not a struggle, I would say, partially a struggle, but at to an extent, it becomes a little difficult for people to accept that this has actually happened,
Happening.
and I
Right.
have to live with it, and I have to move on. So it, of course, and specifically when we talk about children, specifically children who are at a very young age, specifically who are going in their school ages and in their developing years. If they come across this and they constantly keep on asking, where are they, where have they gone, will they return, will they come back, and what do I do now, whom should I talk to? So the main focus here would be to make the child feel comfortable, and engaging that child into something that will help the child release the pressures and release the tension. Of course, talking is one of the ways where you can make the child feel comfortable, but first building an essential rapport with the child, because if and only if the child is comfortable around you, and if there's a considerable amount of rapport which is built,
with
only
the
that the
child.
child will open up, and then you can slowly and steadily take it through the child's space. And of course, having a regular follow-up session with the child as to how is the child doing, playing with the child, making the child feel understand that what has happened, but of course in their own language, because if we talk with the kids in our language, they probably would feel a little lost. But if
Lost.
you talk in their language, that this is something which has happened, so that is something which will slowly and steadily help them to accept and to move on with
Overcome
that.
the.
Yes, yes.
So you're the school counselor. You go to school. You work out with children. So do you believe that? Do you think or you believe that schools should open up, reopen as soon as?
I believe I would rather suggest it's not a force, it's not a compulsion, because owing to the current pandemic and the cases that we are seeing, of course, there's a positive side to it, that we are
Get
seeing
effective
a
as
good recovery rate amongst people who are getting diagnosed with COVID, and most of them are under home isolation. So that is a very positive sign. But of course, the schools have begun for classes from 1 to I think 8 or 9.
well.
So I would rather suggest to, yes, of course, reopen schools, but if proper sanitary measures and if proper care is taken, because see, if we are calling children to the school who are quite young, like in preschool or in the first grade, to ask them to socially distance, maintain social distance, wear mask, it becomes a little tricky for them to make them understand. But at the same time, of course, we want the schools to begin with proper precautions, because this is something which are these developing years of the child, where they learn lot many things in their school life, in these 10 years of their life. It shapes them as an individual, it shapes their perspective. So I would suggest the schools open, but yes, of course, with proper sanitary measures, with proper precautions,
Ways
we can do.
get
Yes.
it right. So do you think like the schools are not there, the child has to do everything, he has to be homeschooled? Do you think just not the homework and everything, he's doing everything basically he does in school, but the main thing, the sense of being physically present is missing? So what is your comment on that? What is the child missing out mainly?
As I say that, I will always say that a child's social interaction, a child's social play is very important, specifically in all ages. Of course, now for us as well. Now for us as well, it's not age specific, but of course for the younger generation, a lot more, because these are their developing years. They socialize, they talk to their friends, they share their toys, they share their books, their notes, and then they have this interaction. So this is something which of course teachers nowadays do send their homeworks via emails, via WhatsApp and these text messages, but unfortunately we had no choice but to switch to that mode. No one was literally liking it, and I would rather say that most affected were the children, because the schools were shut and because everything was shut. There was a kind of a routine that was formed, that from Monday to Friday I have my school, Saturday Sunday I get to play with my friends or we go out with my family, and Monday we are back to school and doing their homework and scribbling work and laughing. And rather, I would say that I really miss that now as well, that I really miss my school days, where we used to sit together and complete our notes and talk to each other. Then we used to have our PT periods, where we used to have those typical exercises. So I think social interaction is something which is to an extent missing out. And to add on to it, of course, physical activity as well. But I think nowadays things are normalizing, so the physical activity is coming back to play, but of course it will take gradually take time to be back on the same track.
I think too much of everything is not good, because as a
Exactly.
child we wait for, when we were school used to wait ki, when we will get the chutti and we'll stay at home.
Exactly.
But now we've got such a long chutti, so the child is irritated from that chutti. He wants to go back, run away to school.
Now it's exactly the reverse of what has happened, that now the child is waiting and longing to be, is that I want to go to school, I am bored home, I don't know what to do, I just have to watch my cartoons, I have to do my homework, I have to sleep, I have to eat. That's the only activity that I'm doing, so there's nothing else. So yes, of course, that is an integral part.
Child wouldn't even mind tests also. If he gets the opportunity to go back to school, he's okay with everything
Of
now.
course, yes. I'm telling you, if I get an opportunity, I will for sure go back to a school, because that is something where you actually spend those refreshing years of your life making new friends and interacting. So yes, of course, social interaction is a must, which is to an extent coming back to to normalcy, but it will take some time.
Exactly. So moving forward, have you, when it comes to children and the parenting styles, even when you're a school counselor, people, even parents come up to you for the parenting thoughts. So is there any sort of parents that come to you during the COVID era for what ways they should indulge in and what changes they should make when it comes to parenting in the COVID era?
Yes, of course. I have been conducting a lot of parenting workshops as well for the parents of age group right from preschool until college students. So I have experienced or have seen parents literally getting worried that what is going to happen or what our childs are going to be if we continue to stay in this world. And because, as I told you, that if there's a work from home right now, every one of us are working from home, we are working from different locations, we are at our own comfort places, our own comfort zones. But of course, to
Exactly.
an extent, we have received, or rather I have counseled so many parents with regards to how you can spend that quality time with your child, because a parent child interaction or parent child bond is something which is very sacred. And it's a bond that doesn't it's like an experience that you learn something new every day. It's very fascinating to learn different things from children. There are a lot many children whom I talk to, whom I interact with. I have learned a lot from them. And I have had told parents that I can understand for the fact that you have your deadlines, you have your work
Right.
assignments, and everything is there. But spending time with the child, interacting, just asking the child that how was your day, what did you do, and appreciating the child is something which is going to keep the child's mental health also at peace. Because there are times where we have seen a lot of cases where the parents have come up to us by saying that I am now finding it difficult to help my child go away from phones. They are just being glued to their phones, and I'm just not able to devote them time. Tell me what to do. So
Right.
there have been times where I have seen children coming to me and telling me that I'm spending more than 10 hours on my phone because there is no interaction in the house. Where should I go? And this is where, that creates a rift between the real and the virtual world. And there's, of course, always a fine line in between. And the child then prefers to stay in that virtual world and, finds it difficult to be in the real world. So, of course, I tell parents to maintain a balance of that real and the virtual world, because real world is something where we learn to value and learn to maintain the relationships that we have. Virtual relationship will be there once, won't be there, they're all temporary. But these relationships in the real world are, of course, are for real. So we
Right.
have told them that take some time out, carefully plan your day, spend time with your child. Whenever you are with your child, keep your phones away. Let you yourself needs to be involved with that child completely. It's just like the parent child time. There's no one in between has to come there. So yes, of course, spending quality time with the children and how to spend, which of course differs from age to age, and having a preschool child or having a child who's in the primary or the secondary, and then having a child who is in the college in higher school. Of course, there have been times where we have, or I have told parents to spend quality time and given them techniques, and parents have reported saying that now there's something which I can call that I have a healthy relationship with my child. I am having and I'm loving this bond that we have right now.
That's absolutely nice of you to help parents in such a way to build a bond. And should we move on to the next question?
Absolutely, yes.
So, what do you think? What is the causes for the child to have such fears when it comes to COVID? Why is he so feared about it? What are the causes?
Because first of all, what happens is there's a lot of when the pandemic just started, there was a lot of negativity around us. People all around us were talking as, how many cases are there? There's COVID, and we have to wear a mask. We have to maintain social distancing. We have to wash our hands. We have to maintain a proper hygiene. And we if we get COVID, then what is
Also
going to
created a
happen?
lot of phobia
There's
around.
a lot of phobia, as of course, and there are a lot of internal and external factors, not just external, but that internal feeling that, oh, they are discussing, what if I get this as well? As I mentioned in the beginning of our talk, that this is
Right.
the big one of course, there are many different fears, but this is one of the fears that a child has, that, what if stays, and, then, oh, I'm not going down. I'm not sending my kids down. We've had a couple of parents in the society that I live, that of course in the initial phase of COVID that we had, the initial lockdown, we didn't see any single child coming down and playing. So that was of course one of the biggest fears, and the other being the school being shut down. So that will always be like the most fear in their head.
Right. So, moving on to the next question, as we discussed the causes of the reason, now we know why do the child has such problems, and how can a parent or anybody around the child can help him overcome it. As a psychologist, what suggestions and tips would you like to give
Yeah.
a viewer?
So first of all, of course, as I said, that there is a flip side to every situation. There is as we say that every coin has two sides. Two sides of the same coin are not same. They are different. So, when a child comes to you with a problem that, look, I have this problem and I have this fear. What if I get COVID? And what if everything shuts down? What if I am under medicine? And what if I have to take medicine? I have to wear a mask? And what do I need to do? In that situation, I would suggest parents to, rather than panicking, or rather than, getting a little that, oh my God, my child has come to me with a fear. What to do now? Even I have the same fear. So what to do now? What to do now? Helping that child or explaining that child that we are here for you no matter what. We will take care of you. Nothing is going to happen to you. We are here. Because these kind of positive words and encouraging words, and explaining them, it does help the child to calm down, because ultimately that is what we want. We want the child to calm down and not get panicked and not get hyper. Of course, because there are a lot of discussions that happen with their friends that, my friend, or his father, he was down with COVID, and this is what has happened. And this is the same fear that the child brings to their parents, and the parents tell that we are there for you, don't worry, nothing will happen, we are going to take care of you, you are our child, you are our responsibility, and no matter what, we will ensure that you are fine. So don't worry, we are here. These motivating and these soothing words are sufficient enough for a child also to calm down and to feel motivated to not being getting bogged down by the negativity around them.
So, moving on to the next question. So, do you believe COVID is becoming the key reason for mental health problems in kids?
I would say it is one of the reasons which has gotten into the child's head, that, as I mentioned, that I'm not able to concentrate well because everyone around here is talking just about COVID and not anything else. They're talking about schools. Are the schools going to reopen? Are the schools not going to open? Are we going to go back to our normal life, our normal routine? So of course there are of course too many other reasons for the child's mental health to get affected, of course, being family pressures, or academic issues, professionally, if they don't gel well with a friend. They, of course, a child has problem. It doesn't require that, a child is 2 years old, what a 2-year-old problem, what a 2-year-old will have a problem. Every child has a problem, but of course the way they express their issues, the way they express their problem, is they are very different, and it differs from age to age. So yes, it is one of the reasons. And as I told you, that I saw a very beautiful play the other day, 2 days back, on how children were literally pleading that, please open our garden so that we can play for some time, and we can spend time, good quality time with our friends. We are not getting that. When so I have had a lot of cases where the parents or where the child is to come and tell us that, I am just talking to my friend virtually, and there is no real interaction happening, there is no real conversation that is taking place. So of course, yes, it is one of the biggest reasons that it has affected because the child feels a little lethargic and doesn't feel like going out. And so I have given suggestions to the parents that you maintain that physical activity on, keep that training on with with the child, so that the child doesn't feel lost, and the child is on the track and is knowing how to strike that balance between his physical health and his mental health.
Right. So shall we move on to the last and the final question? So my final question to you: do you believe fearing COVID is important?
Can you just repeat the question again?
Do you believe fearing COVID is important?
uh Fearing COVID, rather, I would say it has become our internal fear. Rather, we've made it as our fears. We have other things to also look at it. Of course, we have to take care. We have to maintain the precautions that have been, told, that wear a mask, maintain social distance, don't gather in a crowd. But it has become, because of the pandemic and because of the news that we see day in day out, where people are reporting that these many cases in India, these many cases all over the world, we have new variants coming in, that okay, whether this variant is going to be a harmful one or non-harmful one. We surround ourselves at the same time with so much of negativity, and we get attracted to it,
Negativity.
and we forget to see that there is also a positive side. And it's it's something which is called as a negativity bias, that we give more attention to no, but we find it difficult to say yes. So I would rather say that it has impacted a person's mental health to another level because of different aspects, be it career wise, be it health wise, be it personally. I have personally dealt a lot of cases in this pandemic with respect to relationship cases, and parent child cases, and the child being digitally I've spoken to kids on digital addiction, stress management, anger management. So of course, it has developed a lot of innate fears. Of course, externally there is fear, there is scare that when is this pandemic going to end. But the point is, or everything I would like to rather say, that the word fear has two meanings. It is forget everything and run, or face everything and rise. I would rather suggest people that, face everything and rise. It's in our hands, it's our life. We've been given a beautiful life here.
Right.
So, and train your mind to be your best friend. Show that conviction to your mind that no matter what, I will rise from it and everything will be fine soon. And always keep a beautiful smile. Whenever you get up in the morning, just look at yourself in the mirror and smile and say that I'm beautiful. And today is going to be a positive day. And that is something which is going to refresh your mind and help you to stay productive throughout the day.
Absolutely. I think I've learned way too much. And the most important thing is to smile every day and make yourself confident and feel positive about. I think our viewers also have learned a lot of things. Any signing off message, ma'am, you would like to say?
I would say that, as I said, I would always say that perspective matters. Any situation comes in your life, your perspective towards it really matters the most. And face everything and rise. And I would, signing off line is train your mind to be your best friend, and love yourself, believe yourself, and you'll you will be able to find a way out of the problems. Rather than asking why, that why am I facing this problem, ask yourself, what can I do to come out of this problem? That is something when your mind will open those those paths to see that change in yourself. And love yourself, because you are a unique individual, you are a special individual, we all are unique in our own unique and special ways. So
Right.
love yourself, be honest to yourself, and you'll be fine.
Thank you so much, ma'am, for being a part of Solh Talks. And we're really excited. And it was a really wonderful session. And we are hoping to see you for another session at 3:15. So everybody who loved Ketaki, ma'am, you need to stay tuned till the entire show ends, till 3:15. She'll be back with more such insightful tips. So stay tuned, and signing off with Ketaki, ma'am. So bye-bye, ma'am. Thank you.
Bye. Thank you so much for having me.
Bye-bye.